Hi, everyone. Welcome to I'm Key. We're starting this year with a series of videos and dialogues and conversations around HIV and its related themes. And you're very welcome to join us with your comments, with your participation, and also suggesting topics for conversations. We're starting this year with a special guest, Luisa Cabal, who is the Regional Director for UNAIDS in Latin America and the Caribbean. And we want to listen from her about the perspectives of UNAIDS for this year, priorities, and what are the challenges and how we can tackle and address some of these challenges. So, Luisa, welcome to Soy Clave. I would like to start with this very first question. How is UNAIDS seeing 2023 after all these years, these past years of challenges with COVID-19, with the war in Ukraine, and so many other crises? How does this all build up for the scenario that the HIV response will face this year?
Thank you, Daniel, and hello, everybody. It is indeed, we're facing challenging times and times where people are struggling and the most vulnerable are struggling. But it is in difficult times where the AIDS response has also been resilient. So in the context of that resiliency is where we start the year with challenges that we were positioning in terms of we're putting on the agenda the fact that in Latin America and the Caribbean, we continue to face three critical crises: a crisis of prevention, a crisis on the gap, breaching the gap on access to treatment. We're not there yet. And a crisis of exclusion and discrimination. And let me put that in context. We're facing a crisis of prevention because in the context of Latin America since 2010, we have seen an increase of 5% in new infections, of 5% in new infections. While the Caribbean has fared much better with 28% reduction in new infections since 2010, there is much to be done to really leverage and support prevention programs for key populations. So this remains a challenge and a commitment from UNAIDS to support governments and support communities and other stakeholders, leverage the investments of the Global Fund, of PEPFAR, of other donors, to make sure that those investments and the policies are directed to the populations that need it the most. But we also know that we have a crisis of access to treatment, where there are a lot of late diagnoses in our region. And so we need to make sure that we're getting people tested, voluntarily tested, that they know that access to information about their own health is a human right, that they have the possibility of, in their communities, to access testing or self-testing. But also very importantly, when we look at the reasons why people go late or do not want to test, are because they're discriminated against, they're stigmatized again. It's the key populations who are being most impacted in our region. So we really need to combat stigma and discrimination and the underlying structural inequalities that drive this epidemic. So in terms of this stigma and discrimination, there's more we can do, all the way from health facilities, continuing to change the curricula around health providers to make sure we do more of what we know works to reduce stigma and discrimination, but that communities have recourse, to challenge and to complain where there have been violations. But also, we know that law reform works. We know that when there is an enabling environment, communities and people flourish. So there are many contexts where law reform is imperative. We need to decriminalize. We need to support decriminalization of same-sex conduct. We need to combat stigmatizing laws, policies, and regulations against sex workers, transgender people. We need to do much more to eliminate punitive laws.
How do you think we can, UNAIDS from the regional office and the sub-regional office of the Caribbean can support in terms of priorities and how to overcome these obstacles, especially in terms of law reform and access to prevention for key populations?
Our big message is that UNAIDS is an ally. It's an ally to galvanize that political leadership and that political support. So UNAIDS, we need to continue to count on UNAIDS on driving that political agenda and that political support, whether it's for law reform or to make sure that the innovations such as PrEP, such as self-testing, such as the commitment to social contracting are priorities in the country. So we will continue to support governments to go in that direction, jointly with our partners in the joint program, including, for example, with PAHO, with whom we work very closely. But also, a big message for us is that communities count on UNAIDS. You can count on us to support, whether it's decriminalization efforts, whether it's support for law reform, for gender identity laws recognition, but also to make sure that networks of women living with HIV, of key populations, feel that they have an ally to bring about the evidence to make sure that the policies and the investments are going to where they're needed the most.
Yes, the generation of high quality data and disaggregated data to really understand what's going on among these communities and the impact, including of laws towards the response to HIV is also a key priority for UNAIDS. How do you think this can be achieved, or how this can be addressed in the region?
Yes, we have been committed to making sure that governments have the capacities and the systems to have the best data possible that can inform their policies and programs. And I am very happy to share that a few weeks ago, we supported a workshop in Kingston that brought together Caribbean national authorities. And now we have in Panama our Latin American authorities brought together to make sure that they are supported to have the best data systems possible. Because as we have repeated often at UNAIDS, what is not measured is not counted, and then it becomes invisible. So we measure what we treasure. So for us, it is critical to understand what are the trends, which are the communities that are most impacted, what are the underlying inequalities that prevent us from moving forward. And so we remain committed to make sure that we have the best data available, and that data available is used by communities, by governments, by our UN partners, other development partners, to make sure that the investments and the policies are going in the right direction. This is why I invite everyone to also include in your discussions these authorities to inform all the stakeholders at national level of what are the data trends, what is the data in your country, so that everyone has the best data to make sure we're advocating with policymakers and other decision makers around where the investments are most needed. And as we discussed a few minutes ago, definitely we need to inform that the investments need to go to those most marginalized, such as key populations. But in countries that are seeing a lot of migrants, where we have a lot of migrants, we also know that there's a lot of need to make sure that prevention and treatment services are going to those populations. And in many of our countries, of course, to indigenous communities as well.
Excellent. Thank you so much, Luisa, for your time and for sharing with us this perspective from the regional office, UNAIDS Regional Office for Latin America and the Caribbean. And we're looking forward to having more discussions and sharing more more topics and more of these priorities with the Soy Clave platform, the I'm Key platform. So we'll talk
Thank
to you
you.
soon.
Thank you, Daniel, and thank you for inviting me, and goodbye to everyone.